Assalamu alaikum everyone. Today I am going to talk about tetralogy of Fallot. So it is a cardiac congenital anomaly in which the heart comprises of four abnormalities. But before discussing the four abnormalities, I am going to talk about a normal heart anatomy. Here you can see on the left side this is the normal heart, which is comprised of two atria and two ventricle, and the two ventricle is separated from each other through the interventricular septum, in which there is no defect. So the blood from the right ventricle goes into the lung through the pulmonary artery, and from the lungs the blood get oxygenated and then comes to the left atria through the pulmonary vein and then to the left ventricle. And from the left ventricle the blood goes through the into the body through the aorta. Here you can see this is a tetralogy of Fallot heart. The number one abnormality in the tetralogy of Fallot heart is the ventricular septal defect, which caused the mixing of blood from the right ventricle into the left ventricle. And the number two abnormality is the pulmonary artery stenosis. At the origin, there is wall stenosis of the pulmonary artery, which the third abnormality is the right ventricular hypertrophy. And the fourth one, the right ventricular hypertrophy is due to high resistance to the flow of the blood from the right ventricle into the lungs. The fourth abnormality is the overriding of aorta, in which the aorta is arise from near the ventricular septal defect, and during the systole, the blood from the both ventricle mix and goes into the body through the aorta due to overriding of aorta. So this was the four abnormality of tetralogy of Fallot. Now, what are the signs and symptoms of tetralogy of Fallot? The right to left shunt. There is a right to left shunt. Due to pulmonary artery stenosis, the blood from the right ventricle goes into the left ventricle during systole due to high resistance to the flow of blood into the lungs. The other is murmurs, which is caused as a result of ventricular septal defect, and these murmurs are systolic type. These are systolic murmurs. So the third one is a tiring on milk feeding. When the baby is feeding, he will tired easily. The other is clubbing of fingers due to deoxygenated blood and anemia. The other one sign is chest spell. When the baby is crying or when he is feeding, the heart rate become increased, which increase the cardiac output, which will send deoxygenated blood to the body, and the baby get cyanosis and become unconscious. This condition is called a chest spell. The other is the polycythemia, which is a compensatory due to low oxygen in the blood. So the other signs and symptoms like inability to thrive, inability to development are the other signs and symptoms of tetralogy of Fallot. Now these was the signs and symptoms of tetralogy of Fallot. Now, what are the causes and risk factors of tetralogy of Fallot? Alcohol is one of the risk factors for the tetralogy of Fallot. When female are taking alcohol, she will become prone to produce a tetralogy of Fallot baby. The other is diabetes mellitus, and the third one is age greater than 40 years. The other is rubella infection. These are the risk factors for the tetralogy of Fallot. The Down syndrome is also associated with the tetralogy of Fallot baby. The other is it is also associated with Deep-Gauge syndrome. When a baby have Deep-Gauge syndrome, he must have tetralogy of Fallot. Now, how to diagnose the tetralogy of Fallot baby? In order to diagnose the patient, you should to go for three things. One is the history, which you will ask from the patient attendant, ask about the cyanosis, ask about the easy tiring on milk feeding, and ask about the chest spell. Another is examination which you may find a murmur on auscultation, which you may find the murmurs of on a baby on auscultation. And the third one is the investigation. The investigation comprises of two things. One is the chest X-ray. Here you can see the chest X-ray, which you will find a characteristic X-ray, a characteristic shape of heart, which is called a boot shape. Here you can see in the picture. The other is echo, which you can definitely diagnose the tetralogy of Fallot, which you will find the finding on echo is the right ventricular hypertrophy and the ventricular septal defect. Treatment is surgical correction of the ventricular septal defect and the pulmonary artery stenosis dilation. So this was all about tetralogy of Fallot. For more videos, subscribe, like, and share. So thanks for watching the video, and don't forget to subscribe, like, and share with your medical friends. So thanks.